Hello, testing, testing.
Hey, ladies.
Hi, Penny. How are you?
I'm good. How are you?
Good.
Hi, Penny. It's Cheryl. How are you?
Good, Cheryl. How are you?
Want to make sure my microphone works. Thanks.
Are we live streaming already?
Looks, well, I don't know. It says live on YouTube in the upper corner, but
Okay, let me get to YouTube.
I'm gonna mute.
Good morning, Penny. How are you today?
Good morning. Good. How are you?
Good. Looks like we already have 5 of us on. That's a good start.
We do, and we are live feed now,
Okay,
just so everyone's aware.
sounds good. Got to behave ourselves then, right? I think Greg said he'd join us about 8:15 or so too, so we should be seeing my co-leader here shortly.
How are you?
We already have 5 of us on. That's a good start.
Okay, so I do have us up. Live feed now. So yeah, we've got a little bit of a delay on the live feed, but we are live.
Okay, sounds good. Good. So many things to juggle, aren't there? You've got us live, and then you've got the, what is it, a Facebook live or something like that for the rest of the audience?
Yeah, it's on YouTube. So
YouTube, okay.
yeah, so we are live now on YouTube.
Very good. Very good.
Good morning, everybody.
Good morning. Hey,
How
Mila.
are you?
Life
Hi,
is
I'm turning up
good.
my volume so I can hear everybody better.
I should
Okay.
probably do the same. Good job.
Yeah, how's the sound? Everybody hear everything pretty good?
Sounds good here. Penny, how are we
Good.
doing?
Sounds good here.
Good.
Hey, Penny, with the Hope Task Force members being up, we won't have the agenda up, right? They'll just have to follow along on their own.
Correct.
Okay.
Correct. Yeah. So all you're going to see is each other, except when Chris does the screen share of the COVID dashboard.
Okay.
But what you're seeing on this screen right now, now you can pull up, the members can pull up the YouTube if they want to, look at it like that, well, they won't see the agenda either on there.
Because they're going to see the Hope Task Force
Yeah,
members,
yeah.
right?
So you'll have to look at your agenda, like a hard copy agenda. Yeah.
Okay. And Dr. Wilson, you have all the opening remarks and all that good stuff.
That was really nice of you to put that together. Yes, I do. Now I have 2 agendas and I just have to decide which I prefer. I took notes the other day with the one, but the one you sent was so nice. I probably will just use that one.
Whatever works for you.
Yeah, no,
Just
that was
wanted to
great.
make it easy.
And we are live right now, Mila, too, just so you know, it's up on YouTube running live.
Great.
Okay. So I will read the whole executive order. That's the way we usually do it at the board meeting. So it'll just won't take me more than 15 minutes to read all of the numbers, etc. Just joking. I see we have a couple. Yeah.
Hey,
Hi, Chris.
Hey, Chris.
Morning. How are you?
Doing great.
Is this broadcast live? It looks like it's live on our YouTube feed now.
It is.
Okay.
Yeah, we're live streaming right now, and there's a 20-second delay for what people see on YouTube.
Okay. Thank you, Robbie, for helping set it up.
Yep, no problem.
I need a Robbie in my world. Tomorrow I have my DuPage Railroad Safety Council meeting, and I'm chairing the meeting and doing the technology and trying to act like I know what I'm doing.
It's a lot to do.
Yeah,
It is. It's the new age skills we all need.
yeah, that's for sure.
Morning, everyone.
Hi, Greg.
Morning.
Morning, Greg.
How are you all?
Good.
Life is good with nice folks like yourself in our world, my friend.
Right back at you, Lanny. Right back at you.
Thanks. Thank you, Mr. Co-Chair. We're live, so everybody is on their best behavior, as we always are anyway, so that's.
Exactly, exactly.
All right, I'll be back. I'm gonna try to get in from my computer now.
Sounds good.
Okay.
And hey, Mila, just to confirm, so both Access and DuPage Health Coalition are planning to have someone on the line, correct?
Yes, and I did change the Access Community Health Network representatives. So you have on that updated agenda, you'll have
Got it.
2 new names there. And I am expecting them. In fact, I may just email them just to be sure.
Perfect, okay. So we'll give a brief background. I can take this, Lenny, if it's good with you, but brief background on the projects, and then kick it over to them to give some more details. That works.
Great.
Yeah, thanks, Greg. I was hoping that you would do that,
Yeah, of course. Of course.
teammate.
Good morning.
Hi, Karen.
Morning, Karen.
Good morning.
Penny, did we get Liz's request straightened away?
We're live, Karen, on YouTube right now. So just an FYI for you
Okay.
and all the other
Okay.
members who are on. And let me go ahead and take a look here. I'll be right with you, okay?
Okay.
Barbie, do I have the ability to share my screen? Can I try that now? Just in anticipation of doing that later for the dashboard.
Yeah, you should be able to. You can try it right now.
You guys see this map now, the dashboard?
Sure do. Comes through nice and clearly. Your
Okay,
your graphics are wonderful over there.
Yeah, it's Tom Ricker and Kevin Perano at the county's GIS department. They're the wizards.
Yeah, it's beautiful. The AMA morning report says that there's a study, the physical distancing measure may reduce spread of coronavirus. Hello. I thought that was proven, but at least they're reassuring us that yes, it's a great idea. That and masks.
Good to have the documentation.
Yeah, you know, just because it seems logical doesn't always mean that it's the right thing, but the scientists are proving that it's the right thing. The room is populating. It's nice to see all these pleasant faces out there. Hi, Kara. How are you doing?
Morning, everybody.
Morning, Kara. See, Laura Crawford's on the line too. Hi, Laura.
Good morning. Nice to see you all.
Nice to see you too.
Thank you.
Good morning. And as a reminder, as part of this brave new COVID, post-COVID-19 world, in conducting these open meetings, we are all linked in the task force via the magic of Zoom. However, we are streaming this meeting through the magic of YouTube. And so we anticipate that there are individuals joining us via YouTube that are in our virtual audience. So thank you so much for those of you joining us, and we will get started at 8:30 with our formal meeting. Thank you.
And just for everyone on the line and on Zoom, we'll give it another couple minutes before we formally kick off. Our meeting time's 8:30, so hold tight for 2 more minutes and we'll get rolling.
There you go. There you go.
Lanny and Greg, would
Yes.
it be possible to, like, if I could do like a roll call maybe, only because I see some people are connecting by phone, so I don't know who might be participating. Would
Yeah.
that be?
Of course. In fact, I was going to do the roll call, but I'll
Oh.
ask you to do that. That'll be great.
If you've got it, that's fine. I just thought that might be helpful from a minute standpoint, so I know who's participating, if that's okay.
Of course. Well, I was planning that. I'm glad that you said that. So I'll do the roll call, and
Okay.
as I kind of ask people to introduce themselves. So that'll be part of my beginning. Okay.
Great, thank you.
So welcome everyone. It is 8:30 and time to begin our Hope Task Force meeting for July the 17th, 2020. My partner Greg Hart and I will be chairing the meeting today, and look forward to sharing time with Mr. Hart and with the rest of you in this digital world, this live digital meeting that we're having today. A few housekeeping issues. First of all, I would like for everyone to mute if they're not speaking. That'll help make the speakers' voices a lot clearer. And then I would like to do the remote meeting statement. And here goes. Hang in there with me for this boring part of the meeting. Pursuant to Executive Order 2020-07, 2019 ILEO 20-07, issued March 16, 2020, during the duration of the COVID-19 gubernatorial disaster proclamation, the provisions of the Open Meetings Act 5 ILCS 120 requiring or relating to in-person attendance by members of a public body are suspended. Specifically, the conditions in 5 ILCS 120/7 limiting when remote participation is permitted are suspended. Pursuant to Section 7E of this act, today's meeting is being conducted remotely and is being live streamed for the public's viewing. This meeting is also being recorded in compliance with the Open Meetings Act. The DuPage County Health Department is the lead agency for DuPage County in response to the global pandemic, and as such is currently closed to the public except by appointment, in adherence to public health guidelines and for the protection and safety of the public and staff. So the meeting is officially opened. We're officially doing this the right way. The meeting minutes will be handled by my partner in just a little bit, but I'd like to, first of all, do a roll call so that you can be counted for today's meeting. And I'm going to start with Greg Hart.
Here.
Bob Berlin. Daniel Guerin couldn't be with us, Chief Judge, but is Judge Kavita Athnakar, presiding judge of Focus, is she with us today? Judge Kavita Athnakar. Okay. Dr. Rich Jorgensen.
And participants, if your name's called, just respond with here. I know some of us may be on mute, but I see Dr. Jorgensen's here.
Yeah,
so.
he's waving. Yeah, that's good. Thanks. Thanks.
Also
Greg.
is the judge. I'm not sure if you saw her.
Oh, did she wave too?
I see her on
Okay.
in my bottom left.
Okay. Yeah, that would be nice. I'm looking at my paper, so thanks you all for helping out. Penny, are you you following this okay?
Yes, I'm great. Thanks.
So when I call your name, it would be nice if you would unmute and say here, or at least wave if that's not possible, so that Penny or Mr. Hart can see you. So Dr. Darlene Russiti.
Here.
Thank you. Sheriff James Mendrick.
Sir, I'm representing Sheriff Mendrick today. Mike Drugan, Director of Mental Health Services, DuPage Sheriff.
Thanks, Mike. Thanks for being with us. Good morning. Grant Eckhoff from the DuPage County Board. Grant Eckhoff. Jeff York.
Here.
Thanks, Jeff. Karen Ayala. I know Karen's here. Hi, Karen. I can't hear you.
I'm here. My dogs have chosen to start barking at just that moment. Thank you.
Isn't that the way?
Yes.
Bernadine McFarland, Program Manager for the DuPage County Probation Department, is represented by Tim McGavin.
Yes, I am here.
Thanks, Tim. Welcome.
Thank you.
Greg Vesta with the DuPage Police Chiefs Association. Greg Vesta. Keith Creston with the DuPage Fire Chiefs Association.
I am here. Welcome
right.
to the world.
So good to see you, Keith. You're with that great smile of yours. Rich Veenstra, Mayor of Addison.
Here.
Thanks, Rich. Dr. Aaron Weiner won't be with us today. Dr. Weiner left his position at Edward Elmhurst. We will miss his voice. He has been so helpful through the years. Yeah, he's going into private practice. Where
did he go?
I think he's still here in DuPage County. Karen, do you know where we might find our friend Aaron Weiner?
I received a LinkedIn notification that he has launched a private practice. I think it's Bridging Ahead or Bridges Ahead or something. We certainly can get that information and forward it to this group.
Yeah.
That would be really nice because I'd like to wish him well.
Absolutely.
Thanks, Dr. Jorgensen. He certainly will be missed by our organization. We will probably not choose a replacement for him right away. Usually those additions to the task force tend to happen in January. We anticipate filling his role with another mental health or substance use disorder treatment-focused representative. But his years of service are duly noted in the minutes, I hope. Continuing, Jim Scarpace with the Executive Director of Gateway.
Hi, I'm here.
Thanks, Jim. Michelle Worobiak, Chief Counsel, Task. Michelle?
Yes, here. Thanks.
Oh, good. It's good to see you.
Good to see you too.
Thank you. Allison Johnson, Manager, Business and Program Development, CDH, Delmore. Allison? Does anybody see her hand waving? I don't think Allison's with us yet. Lisa Javak, I saw you.
Yep, here. Good morning.
Community Development. Thanks for being with us again. Brad Gerke, are you with us this morning? Brad Gerke is a community member.
Yeah, I'm here.
Oh, there you go. Hey, Brad, good to see you. Deb Lewin, Path to Recovery.
Good morning. I have Aaron's information if anyone needs it. His office is out of the Leeds office in Lake Forest. He's exclusively doing telehealth right now. His cell phone number is the same, and he has a new office number. If anybody needs it, I can send it over to you.
Thank you so much, Deb, for that follow-up. Next time you talk to him, tell him that we wished him well. We miss him.
I will.
Thank you so much. Laura Crawford, President, Chamber 630.
I'm here.
There you are. Hi, Laura. And
Hi.
Andrew Anselm, Director, DuPage Metropolitan Enforcement Group.
Good morning, everybody. I'm here. Thanks for having me.
It's good to have you, Andrew. Penny, did I miss anybody on our list?
Nope, I believe you've captured everyone.
Fantastic.
I do think we have a couple of representatives from the county board joining us as well.
Fantastic. Could you tell us who they are, or should they introduce themselves?
If
Karen?
they could introduce themselves, that would be great.
That would be great. Thank you. Any county board members out there?
I'm not a board member, but Cheryl Marquet, Chief Policy and Program Manager for DuPage County, is on the line to provide a legislative update later.
We look forward to that, Cheryl. Thank you so much for being with us this morning.
Yep. And I do believe, Lanny, members Liv's Chaplain and Mary Ozog were planning on joining. So if they're not on the line, they may be shortly.
Wonderful. That's good to hear. Well, at this point, I'm going to turn the meeting over to you, Greg. I think I've taken enough time. I'll be back though.
Well, first and foremost, just want to thank everyone for joining this meeting today. I know all of us, while we've been working through the COVID world, and I know the health department's been inundated with everything related to that crisis. It's important to note that the public health crisis related to substance use disorder has not dissipated at all during COVID, which makes the work of this task force committee that much more important. So it's really great to be able to restart these meetings and do so virtually so that we can continue the important work of combating substance use disorder in the county. With that, everyone should have received some of the minutes from our last meeting, I believe in January, via email, and it was accessible online via our website. So right now I'm just going to ask members of the task force if they have any additions, corrections, or deletions from the minutes that they had listed, or if we're ready to accept and have consensus on those minutes as written. Any corrections from any members of the task force? Okay, hearing none, do we have consensus? I think we could just say yes if so.
Yes.
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 Okay, great. Okay, so we can consider those accepted. Moving on to the next order of business, Lanny, I'll just pick up with this one, is it's public comment. I believe due to our remote meeting, public comment was accepted via online submission. And Penny, do we have any public comment for today's meeting?
We do. If you'd like, I'll go ahead and read them into the minutes.
Yes, please.
Okay, we did receive 3, and not all are associated with Hope, but the state's attorney did say that all 3 must be recorded in the minutes. So the first one is from John D. And his comment is, all schools, especially high schools, should be shut down and students should have online learning only. If we send our kids to school while the county has almost 10,000 cases, they will bring the virus back home and spread it to their families, who then will spread it to their coworkers and friends. The virus will definitely increase if hundreds or thousands of children gather in one building, multiplied by all the high schools in different towns. Schools cannot reopen. The second comment is from Stephen Stefani, and his comment is as follows. We want to update you on our efforts to provide harm reduction services in DuPage County. We are happy to announce that the Live for Lally Harm Reduction Mobile Unit will be providing services to Schaumburg starting in August. We have been working with the Schaumburg Police Department on rolling out harm reduction services. Our goal is to implement harm reduction services overdose hotspots in the county. We are looking to collaborate with stakeholders in these areas. Thanks, Hope Healing. And the final comment came from Richard Lasik. Thank you for your time today. The Lasik family is a Hinsdale family of almost 20 years and lost a dear son last September. Through the efforts of many amazing people, they've started a charity called Crisscross Foundation. Crisscross's mission statement is expanding awareness and access to treatment for mental health, addiction, and suicide prevention for young adults and their families. And those are the comments that were received.
Thank you very much, Penny, and thank you to those public commenters for their submissions. It's always great to hear, particularly from some of the local members. If everyone could go on mute, I know there's a little bit of background noise. Okay, we'll proceed. Always great to hear from local charities and foundations here in DuPage County that are partners in this mission to combat substance use disorder. So thank you to Hope for Healing and the Crisscross Foundation. Moving on, I believe that the next order of business we have today is a COVID-19 update. I know this is an issue top of mind to everyone. And as we've seen, it's had some correlations with what we, I believe, have seen in terms of data, in terms of the opioid crisis. But Karen Ayala, I believe you were going to give an update 19 from the health department. Karen, I think you're on mute.
Yes, sure. And Chris is going to help drive the video. If you haven't had a chance yet to check out the DuPage County Health Department's website on COVID, first I'd like to just take you to that page. If we could go there first, Chris, and then we'll get into the map. So this is the landing page for the health department. And then we have a special edition for COVID. If you go up a little bit. Yeah, I want to show the different tabs, Chris. That's where I'm. There you go. Under health services. Then if we scroll down, each of those different buckets that Chris was pointing out on that list, list in words, is actually a graphic tab that has different information for different sectors or information on different areas. Thank you so much. So we are well aware of the fact that all of us are inundated, some more than others, with COVID related information, and have done whatever we can to streamline and really reduce the number of online clicks that it requires people to reach the information that is being provided. We feel like it's very important to maintain this from a local county level due to all of the misinformation spreading both intentionally and unintentionally across social media and other media and networks. So first, I wanted to make sure that you are all aware of that. And then secondly, we'll dive very quickly into our data. And for those of you who have been on weekly or biweekly calls, Chief Creston, you come to mind. If you'd like to do any of the explanation, feel free to jump in because I know you're very familiar with this. On our dashboard, it's a dashboard, but then it has specific other links within it. So you'll see where Chris is right now in the top and middle. We have the number of cumulative cases by municipality across our county, which is interesting, but the further this pandemic lasts or the more time that is we are dealing with this pandemic, simply the numbers get bigger and bigger. So it doesn't really tell us much. So with the magic of technology, we have added some layers. So if you go to COVID cases the last 14 days, you can see what we feel like is more relevant and certainly more recent information about current spread. That same data is broken down for hospitalizations and for deaths. I think it's important to know that we still are experiencing about a 20% hospitalization rate for individuals with COVID positive tests. That has remained fairly steady. Thankfully, and through the heroic efforts of our healthcare partners, we are getting a better handle on treatment for individuals who come and develop very acute illnesses as a result of their COVID. So that information is there. On the left column, you'll see that we are nearing 10,000 cases, as the individual who submitted public comment indicated. That number, again, as we have said throughout this, is likely only a fraction of the number of cases within our community. However, we are reaching, I think, a significant milestone with that number. We also provide information on age groups of individuals or residents who are testing positive. And again, we see that there is a widespread across age groups of virus. You've all been hearing about the numbers of young people across the country who have tested positive, and we are certainly seeing a similar rise in our 10 to 19 and our 20 to 29-year-old age groups as well. We have a breakdown by sex. And then in the lower left of the dashboard, you will see what is being referred to as the curve, the epi curve. And you will see that these are cases that are reported by date. You will see that we had our highest dates at the end of April, first couple weeks of May. Then we had a very steady decline, and we are watching this gradual increase. The blue line represents the 7-day rolling average of cases, but we are keeping close watch on this number going forward. You'll also see that we have the positivity rate indicated for our county. This is the raw number of tests that have been performed. Blue indicates those who are positive. And then we have calculated based upon that, the positivity rate. And this was the factor that Governor Pritzker was announcing earlier this week that if we see rises above 8%, it will require some further restrictions being imposed most likely. You will see that when we started this, we had positivity over 35 on a particular day. You've seen the gradual decline of that as more and more individuals have access to testing available. But again, you'll see that we haven't gotten to zero, and we haven't continued on our decline. So we continue to have concerns about the spread of COVID across our communities. We do not break down the positivity by community and feel that it would not provide a picture that is public health relevant because of the way that our communities and community residents interact with each other. We do, however, provide the number of cases by municipality. And there's even a very cool feature that if you want this type of information and are living in Glen Ellen, you could click on your community and see how the outside boxes then updated. So in Glen Ellen, we have a total of 200 cases. Then we have the age group distribution of cases specific to Glen Ellen. Those all update as well. So if you're interested in your own community, there is that feature. Unfortunately, we too are reaching a grim milestone around deaths, closing in on 500. Again, the deaths are primarily associated, 76.6% of deaths are associated with a long-term care facility case. Those long-term, it doesn't necessarily mean they're all residents, however, which I would caution us to jump to that conclusion. Long-term care facility associated cases in general account for only about 18.6% of all of the cases in DuPage County. We are seeing the racial and ethnic disparity with Latinx population cases accounting for 5 times that of counterparts. Our Black resident cases are 2 times as many as their counterparts. When it comes to mortality, we see a twofold increase in our Black population deaths compared to their other counterparts within our community. However, we are seeing a 93.7% recovery rate amongst people who are tested for COVID, test positive for COVID. And this is the definition of the recovery rate: an individual with positive lab test who has not passed after 42 days. That is considered a recovery rate. We know that individuals continue to have ongoing lingering symptoms, some of them requiring rehabilitation or long-term hospitalization. But right now, that is the standard definition for recovery rate. So with that, did I miss anything, Chris?
Just point out the 2 charts in the bottom right that tell us a little bit about what's going on now in terms of hospitalizations and deaths, and would be 2 indicators that we're watching. You've seen case rates rise in the previous 3 weeks. Hospitalizations and deaths do lag those numbers a little bit by a few weeks based on how people develop illness. So you'll see the hospitalization trend looks very promising and good, and we are endeavoring to keep it that way. But both hospitalizations and deaths are reported similarly by day to help us understand the severity of disease, not just how many cases, but what's resulting from those. And I think you hit everything else, Karen. I would, unless you'd like to, just point out that through the bottom of the dashboard, there is a link to some of those race and ethnicity severity data posted through an additional link that takes you to, oops, not this page.
Although while we're there, I just would like to point out that we were able to open our own community-based testing site at the fairgrounds location. It is free and open to anyone. It's open Tuesdays through Saturdays, 7 a.m. to 3 p.m. Although cars are cut off at 2 so that we can wrap our clinic at 3 o'clock. Yes, you don't have to be having symptoms, but certainly if you are having symptoms or have been in contact with somebody with symptoms, you can certainly avail yourself of that testing site. The other factor with this site is you must be in a vehicle with windows that are operational and can remain closed, which is an extra layer of challenge during this really hot period of time. But that's part of the PPE for both the people inside the car as well as our staff. The other factor that has resulted in many cars being turned away is that they bring their dogs to the testing site with them or animals. And again, we feel like we have enough challenges in doing the testing. So we don't allow cars with dogs in there or buses or trailers. So thank you so much for scrolling down, Chris. And now the other statistics.
It's hiding behind my control panel. Sorry, here we go. So through that link on the dashboard, if you're interested, and it is important for us to monitor and react to some of the disparities we see in race and ethnicity of cases and deaths in our community. So there's much more data posted here that as you're working on these issues or working with communities, we want to reflect this information back and let it drive our actions to reduce disparity across the county. So much more information presented here. You know us at the health department, we like to have the data, but we also like to act on it. So would encourage you to take time to look through this as you're able. And I'll put links to both of those in the chat.
So we'll turn it back to you, Greg.
Thank you.
Or for questions.
Yeah, and that's what I was going to go to. So if there's any questions from members of the task force, what we're going to ask you to do is either wave in front of your camera. It's very, very imprecise how we're going to call, unfortunately. Either wave in front of your camera or you can utilize the raise hand function in Zoom. So right now I'll pause, and if there are any members of the task force who have questions for Karen and Chris, please feel free to raise your hand now. Okay. Seeing none, Karen, Chris, thank you so much for the very informative deep dive on the COVID data. I want to take the opportunity to thank you and the whole health department team. And Lanny, I'll include you in this as well, on the great job that you guys are doing for the county, the people of DuPage on the COVID crisis. Obviously, this is something that's unprecedented, but I think our health department has acted quite effectively and professionally, and really appreciate all the work that you guys are putting in. I know it's not easy, so thank you for that. So with that, I'm going to switch up the agenda slightly, if that's okay with everyone. We just went through the COVID related data, but we have seen other types of increases in our opioid related data, unfortunately, as well. And Dr. Jorgensen, our coroner, is on the line, and I believe he was going to provide an overview of what he's seeing and his office is seeing, and I'd like to move that up now. So Dr. Jorgensen, if you're ready to brief the group, the floor is yours.
I am, thank you. Can you hear me all right?
I can.
In these Zoom things, you never know if you're on or off or doing something embarrassing, right? So, so I have some very disturbing data to present in the COVID world where we're all hiding away in our houses. This opioid crisis has certainly fallen off the radar, and the people who are fighting for their lives in this opioid crisis have fallen off the radar. So our data shows that both suicides and overdoses are at an all-time high and are at least 50% over what they were at this period of time last year. On May 13th of this year, I put out a public service announcement because we had 20 deaths in a 3-week period. During that period of time, we had a number of days where we had 2 overdoses in the same day, and we had 2 days where we had 3 overdoses in the same day. And State's Attorney Berlin and I were both so concerned about this that we conferred, and I went back and looked at literally every one of the cases, and felt so compelled that I needed to put out this public service announcement to try to get the information out. And at that point, in 3 weeks, we had 20 overdoses in 3 weeks. We then tried to put that into context. So if I could just give you an overview of my view on this. So when I first presented the overdose data, calling this an epidemic in August of 2013, that year we had 42 overdoses. So to put that in context, that was the point where we were starting to talk about this as an epidemic. Last few years, we've had close to 100 overdoses in each year. So last year was 96 overdoses. So you can see that we over doubled what it was when I first took over as coroner, and in 96 in the last year. So if you put that in context, the numbers are very terrifying. So in the first 5 months of this year, so ending in May, the end of May is where we have complete data to, we've had over 60 overdoses. During that period of time last year, we had 40. So that's a 50% increase of the number of overdoses that we've had in that period of time. We've had a similar increase in the number of suicides, though in the beginning of the COVID shutdown, we had less suicides and more overdoses, and now we're seeing more overdoses. The drugs that are being used are, again, this huge shift towards fentanyl and fentanyl-related drugs. We had only 1 overdose related to heroin. We had 22 heroin and fentanyl. We had 25 with just fentanyl, 3 with just prescription overdoses, 2 cocaine overdoses, and 7 others, methadones and other type of drugs. So this is very alarming. And again, as I said, I looked into each one of the cases, and I'm gonna ask Brad and Jim to comment on this, because when I finished looking this up, I called Brad and I've emailed with Jim about this, but I talked to Brad and a couple of other people that are in the recovery business, and Brad will tell you, but their phones are blowing up and they're having people calling everywhere. But the data that I was really amazed at is virtually every single one of the cases that I was reviewing of overdoses had these components to it. People that either had a history of depression, had a history of mental health issues, they were living alone, often due to financial or marital problems. We had a number of people who were living in an apartment who were going through divorces or something like that. And then a large number of people that were either in recovery or previously been in rehabilitation for addiction problems. So we had a number of people that in talking to their friends or family said, they were in recovery, they were doing great, everything was fine, and they relapsed. So it's very amazing that almost everyone had that constellation of problems. So again, so to summarize though, we've had over 60 suicides and over 60 overdoses in a 5-month period of time. That's about a 50% increase over the same period of time last year. And I don't think there's any question that this is related to the circumstances of taking people whose life is hanging on the idea that you need to get out and talk to your sponsors, or you need to talk to people if you have mental health issues. You need to be with people, you need to have companionship, and instead you're locked in your apartment by yourself and stuff. So I would like to ask Jim and Brad to comment on that as far as what they see, and I'm happy to answer any questions about the information that I just presented.
Thank you, Dr. Jorgensen. Brad and Jim, feel free to comment. I'm interested to hear your perspective on this.
Yeah, I mean, I agree. I think, Dr. Jorgensen hit it pretty accurately when he said that, due to the social distancing, what we're seeing is a lot of emotional isolation, a lot of disconnection from support systems. And for someone with a substance use disorder, we know that those two pieces are critical and crucial to their recovery. And so we have also seen, substantial people calling, asking for help. I think in the treatment environment, the COVID pandemic has made it much more challenging, because obviously in the treatment environment, our priority is not only helping people get treatment and stay in recovery, but also keeping them safe from the illness, from the COVID illness, from the pandemic. And so we have to test everyone as they come in. As a result of that, it's created like a gateway, for example, we've created admission units where people are coming in. We're trying to isolate them from the rest of the clients as much as possible for the first couple days while we're waiting for their test results to come back. The number of beds we've had pre-COVID to what we have post-COVID are limited because of social distancing. We want to make sure that, people in rooms are safe from each other. And even if someone were to test negative when they come into the center and they're not leaving the center, there is a possibility that they could test positive a few days later, as we all know, or start to develop symptoms. And so it's made it really challenging in terms of, limiting our ability to treat as many clients as we would have liked to have treated, or like to treat, or have treated historically. And at the same time, recognizing that there are more clients or individuals than ever that need help, as Dr. Jorgensen pointed out. So I think, all the treatment centers across the state are doing everything they can, but the pandemic has definitely made it very challenging to help as many people as we would like to.
Yeah, thanks, Jim. And experiencing the same thing over here. For me, it's where do you begin? Because the whole world has been flipped upside down in the many hats that I wear. As director of operations for Banyan Treatment Center, nationwide, a lot of our centers, we've been getting so many phone calls just with people finally coming to light with substance use disorder and reaching out for help. And the screening process has been much more intense as far as questions. Have you been out of the country? Have you come into contact with anybody that has COVID? Have you been sick? We're taking temperatures 2 times daily for our patients and for staff. We're doing antibody tests when they arrive for the IgG and the IgM antibodies to see if anything has developed along with those COVID tests as well. As far as, through the foundation, being a co-founder of the 516 Foundation, a lot more phone calls, people not sure where they can turn to for help, because especially early on in COVID, a lot of places were closed or had limited hours or certain ways on how to get a hold of people for some of these services. I have witnessed just out in the community, being 9+ years in sobriety from heroin, fentanyl, crack cocaine, alcohol, you name it, I did it. I have noticed a very heart-wrenching numbers in overdoses and deaths due to the isolation factor, the depression, fear just of the initial COVID. Of some people thought the world was ending and didn't know what to expect. And then after that kind of started to go away, as numbers still continue to climb, the fear of economic insecurity. How am I going to support myself? How am I going to support my family? The fears of what if and what can happen has driven a lot of people back to it, along with the depression, being stuck in your house if you're on a quarantine or can't work. It has taken a huge toll on the recovery community. Now, we do have our are strong people in sobriety. You know, I have witnessed people with, you know, 2, 3, 5 years of sobriety continually. The ones that I'm super proud of are the ones in early recovery during this time. With 30 days, my friend Nick P, he just celebrated 30 days. Another good guy, Kyle K, he just got 1 year. Those are the ones that I think are the most vulnerable, that are entering new sobriety and just don't have the platforms that are needed right now, which would be going to the 12-step meetings, going to the support groups. It's kind of like us on this platform right here on Zoom. Yes, we're able to adapt and overcome and be able to connect us here as a Hope Task Force, but you don't have that meeting after the meeting or the meeting before the meeting where you can kind of, if you're going through something, or if you need the network, or you need some information on a more intimate level, you just don't have that connection. I've also experienced just through, you know, the Zoom meetings, sometimes, you know, you get Zoom bombed with people that aren't in recovery, that are coming in and having drinking parties in the middle of an AA meeting, or doing other things. So, you know, I believe us in recovery will continue to prosper. It's just finding out the new ways on how to do it in this here time. Meetings have started to open up, but they're limited to numbers of people coming in. I know if I were to show up to a meeting, if there was a newcomer and that we're at capacity, I would step out of that meeting and let them in, because they're our most vulnerable at this point. You know, I do know that the stimulus checks came out, and we did see a lot of kind of overdoses after that. You give somebody $1,200 and they're sick with alcoholism or drug addiction. That's kind of a gateway into launching into a further downward spiral. But to be honest, you know, the recovery community is suffering right now, and it's hard. I feel like we've made so much progress. I think this is a mild setback. With that being said, a lot of people have adapted, and I see light at the end of the tunnel right now, which is important for me to say for my recovery and for everybody in the Hope Task Force to keep that hope up. People are continuing to strive on.
Well, thank you, Brad, Jim, and Jordan. I'm going to open it up here for questions in a minute, but if I can indulge real quick, Dr. Jorgensen, just one question for you. As far as the age distributions that you've been seeing reflected in the overdose deaths post-COVID, have there been any different than previously? Or?
No, no, it pretty much mirrors what we've been seeing in the past. But as I pointed out in the last time I reported to you folks, the general age of our overdoses has changed over the last couple of years. From when I first started talking about it in 2013, it was predominantly teens, 20s, and early 30s, and then a smattering of other ages. Now, there are more 30-year-olds that are dying of overdoses than 20-year-olds. So we're starting to see it move a decade or so older, and that's still reflected in these numbers.
Okay. Thank you. And then second part, and this is definitely a loaded question. I'm going to direct it to Jim, Dr. Jorgensen, and Brad, but I'm sure many members of the task force may have points of view on this. You know, we're going to be going in subsequent agenda items to talk about what we've been doing as a DuPage County community to help combat the opioid epidemic during COVID. I think there's a number of things we can point to that we've really put a lot of effort into, but you know, particularly around the emphasis on social isolation and the impact that that has on substance use disorder. Dr. Jorgensen, Jim, Brad, I mean, what can we, not just DuPage County, the one thing I will say is that, correct me if I'm wrong, Dr. Jorgensen, but nationally we have been seeing an uptick, you know, right, even just beyond DuPage County's borders. What can we as a community do to better address this situation in the COVID world? I mean, is it better access to telehealth? I just would love to have your ideas. And if anyone else has ideas, I'm interested to hear.
Well, your point about, you know, this isn't DuPage County, and we, even though we've led the way on data and education and all these type of things as a county, we're not leading the way as being an isolated county having this problem. In fact, last week, Cook County Medical Examiner actually put out a release stating that she thought that they had doubled the amount of overdoses. We're at a 50% increase, and she was thinking that they actually doubled it. So this isn't an isolated thing. We're seeing this all across the country and all across the area. But I think that there is a way that we can reach out to the vulnerable people that we know, and my reading of this was that we need to think about people that we know, friends, family, relatives, whatever, who we know have those issues of depression, of isolation, of mental health issues, and those who are struggling with addiction, either they're in recovery or going through recovery. And we need to go to their house, and we can socially distance and meet with people in the front lawn or through windows, or call them up and try to diminish the isolation and loneliness. And you know, I feel it myself. I want to go to a restaurant and I want to meet with my friends and I want to be normal. So I can't, having not gone through it, I don't understand. I can't feel what it's like for someone who has mental health issues of depression and being totally alone. So I think one of the things we can do is try to identify in our lives people that we might think need a call or a visit. And there are safe ways to do that and to try to do that. So that's one of the things that I've thought of that we can do. So I'll pass along to Brad and Jim.
Yeah, I mean, I agree. I mean, I think at this point, we want to reduce as many barriers to support and connection as possible and really break down that emotional isolation piece for individuals who are struggling, offering as many platforms as we absolutely can. And as Brad said, the virtual platform is not as effective for some people, but for others, it may be their only way to get the support they need during this time due to concerns about the virus or limited ability to get back and forth to a treatment center. So offering as many platforms as possible. So for example, at Gateway, we're doing the virtual outpatient services. We have face-to-face outpatient services. Obviously, they're more limited in number right now to protect the clients as they're in treatment. We brought on an alumni coordinator to do exactly what Dr. Jorgensen said, which is basically reach out to people who have been with us for the last year and check in on them. How are they doing? Do they need any assistance? What kind of support do they need right now? Offering them access to services and people, whether it be face-to-face at the center or virtually. As Brad pointed out, you know, for a small time after, you know, when this first hit in March, a lot of treatment centers closed or limited services. A lot of treatment centers, including Gateway, have reactivated those services and are really trying to connect as many people to supports as possible. I think it's just really important right now to get that message out, whether it be, you know, even through the health department in DuPage County, if you put something on the website to say, you know, if you're struggling, reach out. You know, we know that there are those phone numbers through the state that we can connect people to so that it can help get resources and services. Just the more we can do to get that message out there right now, because people are isolating and they're not getting the same support and emotional connection to others that they used to get. So the more platforms to break down barriers and increase access, the better.
Yeah, I'd have to agree with Rich and Jim. You know, when it comes to addiction and how can we help, I think a lot of it's case by case. We have to really meet whoever's suffering with substance use disorder where they're at. You know, if you were to give me directions to your house and I called you and I said, hey, I'm lost, the first question you would ask me is, where are you coming from? If you give me directions from the north side, I'm on the south side, it's going to do me no good. So what I mean by that is, you know, if somebody is struggling with substance use disorder and they're not quite ready for help and you're part of the family, check in with them, see how they're doing. You know, maybe do some of those social distancing visits. If somebody's, you know, amped up about recovery, then you can definitely start meeting at pavilions and holding your own AA or NA or CA 12-step meetings. If somebody's kind of on the fence or just getting out of treatment, I know that, you know, Banyan, I'm sure Gateway and all the other surrounding facilities, they have lists of numbers of people that are in recovery so they can start connecting while they're in treatment. So when they get out, they have a fighting chance of a sober network or support. So it's really just meeting whoever's suffering where they're at, whether they're in active addiction or in recovery. I know myself, I try to make, 5 to 10 phone calls outside of the ones that I get, just people out there that are in recovery, just to check up and see how their day is going. It's really coming together as a community, and we have so many people out there that are affected with alcoholism and drug addiction, to where I'm sure, everybody knows somebody. So if it was just that simple courtesy call of, hey, how's your day going? For me in recovery, that is a bright spot in my life, just to know that somebody's still out there thinking about you and wanting to help and aid and guide you to a better life.
Thank you, all of you, for your comments on that. I'm going to open it up to the rest of the task force now. Are there any questions, comments? If so, feel free to raise your hand. Lisa Schwach.
Yeah, Brad, so you mentioned about, for support meetings and things like that. And sometimes your experience, or maybe you've heard from others that their experience has been there's not enough slots available for the digital technology, whatever platform is being used. So I'm curious if this is something for those of you that are, working with these types of groups, and that I know from personal experience with my organization, for Zoom, say a subscription where you can have you can exceed that 100-person cap. You could go up to 500 participants. That costs, I think it's $1,400 per license. So I'm wondering if you're aware of any funding gaps would we be able to expand the availability of these types of services that, perhaps there's some small nonprofits that can't swing the, 1,400, or if you're getting 2 licenses, 2,800. Is that something that anybody in this meeting is aware of or has experienced?
I have not. One thing
sorry, Brad, go ahead.
One thing I have experienced is if you don't have Zoom Pro and you're hosting the meeting, you only get 40 minutes. So in the beginning, those were cutting out. What a lot of 12-step meetings had started doing is whoever's chairing the meeting, with funds gathered through our 7th tradition, we would go ahead and purchase a Zoom Pro, or just take it out of your own pocket like I did. Just for the price, just let's make it happen so people can actually get their full hour. 500 people would be a lot of people in a meeting, but they have had some international meetings where that has happened, and those have kind of stopped because a lot of people were Zoom bombing them. So it's kind of gone more to a more intimate numbers as far as meeting settings go.
I was just going to add that I'm sure the Zoom technology will be very valuable in November, December, January. But right now, we'd strongly encourage, and we're having these discussions with schools, in fact, the more outside activity you have, better off. So we've seen that with restaurants and dining, that we did outdoor dining first. Same way with meetings. If we could really encourage people to utilize the longer days, the outside, although it is beastly hot during the day, so I don't think I'd want to be in a noon meeting at a beach anywhere. But and maintaining, the face coverings and the physical distance, that would be much better from a public health standpoint in a COVID spread than an inside meeting. And so the more we can encourage people to, because there is something very different between seeing you all, and it's great to see all of your faces on my screen, than it is to actually be in the same room with another human being. I think that as we go forward with COVID, we need to learn how to live with COVID more safely. And so if we can reduce our risk, we can't have inside meetings, but we can have outside groups. We can't have this, but we could have this. I really applaud the ongoing persistence and creativity of our substance use treatment partners and mental health partners for finding what can we do? How can we reach out to people? And I'm afraid that we're so early in this response to the pandemic that we we will see additional iterations of ideas and creativity coming, which unfortunately may not be in time.
Greg, this is Lanny.
Yeah, go ahead.
This is so good. We could take the next 2 hours talking about this, and I hate to prolong it with this question, but hopefully it's pertinent to Dr. Jorgensen. It's appropriate that you combine suicides and overdoses, it seems, because don't the substances decrease inhibitions, and so people are more likely to commit suicide if they're overusing a drug or alcohol. How do so that's one question, and then together, how do you know the difference between an overdose and a suicide?
That is a great question, Lanny. We actually, the coroner community is often criticized for our labeling what's called the manner of death. And so manner of death is homicide, suicide, accidental, things like that. So, you know, what's the difference between someone who is so frustrated with their addiction that they take more drugs on one day than another and overdose? It's very difficult. The answer is it's very difficult to determine that. And we actually have had a number of times where one actually last week where a person told his mother that I'm going to go into rehabilitation tomorrow. I'm tired of being an addict and I'm going to go into rehabilitation tomorrow. I want you to take me. And the parents went out to a party and came home and their son was dead. So what's, you know, we have this happen all the time, and it's a very difficult thing for us to do. So most of us in the coroner community feel that to call someone a suicide, there should be very specific comments, knowledge, notes, something to really do that. But we really suspect that there are many more suicides that are performed by using an overdose amount of drugs than are actually reported. So yeah, they are very much related, and they are certainly there are many more suicides that are done by overdose than are reported in our statistics.
Great answer.
I hope that answers your question.
Sure does. Great answer. Thanks so much, Rich.
Thank you, Lanny. So I know we got a number of other things on the agenda. I'm going to offer one more question, and I think Dr. Rossetti has a question, if I'm not mistaken. So Dr. Rossetti, please proceed.
Actually, not so much a question as just FYI. So we have a core at the Regional Office of Education, about 20 social workers, behavioral interventionists. Because of this remote world that we're living in, that we touch base and we run at-risk programs, and we work with some of the most vulnerable students, and largely they're referred to us because of drug problems. And so we are touching base. I just wanted you all to know that we are touching base with these students, largely from 16 on up, almost every single day, doing some type of a touch point with them, recognizing their vulnerability during, you know, this remote time and their isolation. And many of these students come from very unstable homes. So we want to do, and we've had some really good results. So I just wanted to tell you, I appreciated the comments that you all made about, you know what, taking care of those that you know that are the most vulnerable and kind of checking in with them. So that's out there. I wish we had more help to do that, because there's lots of students, I think, that we're not aware of that could use our help too. But at least for now, there's something going on. I just wanted you to be aware of that. And thanks for all you guys are doing.
Thanks,
Dr. Rossetti. Unless there's any other questions, comments, I know this is a topic that we will not just be exploring once. I have a feeling we're going to be discussing this at future meetings as well, because we know that COVID isn't going away. So this is a challenge that we're going to be faced with for the foreseeable future. But Dr. Jorgensen, I just, again, wanted to thank you for all of your leadership on this issue, dating back to 2013. This is an unprecedented time, without question, for all of us. And without any more questions, it's definitely an unprecedented time for your office. And I just want to thank you for all you're doing to help address this issue in our county.
Thank you.
Okay, great. So we're gonna move on to the next agenda item. As I alluded to, The county of DuPage is doing a lot to help address this issue right now in light of the recent data. I think the last meeting we had back in January was shortly before we announced our grant recipients for the grants that we offered last year with the $100,000 allocated by the DuPage County Board. I'm sure all of you have seen this, but those grants were awarded to Access Community Health, the DuPage Health Coalition, and the Edward Foundation for 3 different innovative projects that are going to help reduce substance use disorder in our county. So I figure we take the time right now to give a brief update on each of those programs. And I'll start right now with Carmen Burgos and Rosalind McGee from Access Community Health Network.
Good morning. My name is Rosalind McGee. I'm the manager of Behavioral Health Supportive Services with Access. So I manage our MAT project. We just recently opened up a new MAT program in West Chicago. It's located at 245 Roosevelt Road in West Chicago. We started the program on July 8th. We are seeing new MAT patients. During this pandemic, we have been having in-person visits and also been using telehealth visits to communicate with clients and working with the care team. The MAT clinic for that particular site is on Wednesdays and afternoon. If someone wants to come into the MAT program, you have to call the clinic and make an appointment to see Carmen Burgos. She's the lead CHS out there, and she does the intake with the patients to see if they qualify for the program or to see if we need to refer them to another line of services if they need other help besides what we can give them at Access. When the patients come in for a visit, they'll see Carmen Burgos, the CHS. We also have behavioral health counselors who work with the clients. We were doing groups, but now we're doing individual treatment sessions with clients. And then they'll also see the medical provider and get a physical and get the prescription for either Suboxone or Subuclade with the medication they'll be using for their medication-assisted treatment for use with their substance use disorder. We take a variety of different insurances. Access is a FQHC. We've been in the community for a long time, and we also have another site that we opened in Bloomingdale who's been there for a while, where we provide MAT services too. So we have, in total, we have 14 MAT sites within Access, and we try to make sure that we're going to communities where people need the help and where we can make sure we're doing the best services that we can. During this time with the pandemic, since we're doing more telehealth visits, we have community health specialists who work with the clients in the MAT program, and we've been reaching out to them a lot more via telephone, just to check on them and to talk to them, because we knew, as you guys talked about, the social distancing and people being alone and being isolated, we're trying to get them much support as possible. We also been referring people to use, like, they have NA meetings on YouTube to give them some type of support, and we're doing inpatient and telehealth visits, so we are practicing social distancing, but we're trying to meet the patient where they're at and get as much support as we can during this time. Carmen, would you like to add anything? Any questions for me or Carmen?
Any questions?
Rosalind, this is Karen Ayala from the DuPage County Health Department. First off, thank you so much. And secondly, as I see my internet connection is unstable, I hope you can hear me okay.
Yes, I can hear you.
How many clients have you been able to serve in the DuPage County through the MAT program in Bloomingdale? Because I know that one's been going for some time. Have we been doing our part to refer people to you? How can we build those numbers?
It's been a slow process. Right now, I think there are about 20 patients enrolled in the program, but that's the current enrollment. But we have some people, they might start the program and they might not complete it, or they might come one week and they don't come the other week. We always keep the slots open for anybody who wants to come. We never turn anyone away. We could get more referrals for the program to build it up, and that's the purpose of us. Thank you guys for inviting us to this meeting so we can tell you about the programs we do have within Access. We see that in the communities that we're serving, it's a real need. And once we can get somebody in the program, it does make a difference. Having the wraparound services is very important, having a case management, having a behavioral health counselor, and also working with the health center team, the care team period, makes a big difference. When someone walks through the doors, they know they're here to get services and people are respecting them and giving them what they need. So we try to work with the whole clinic to make sure everybody's aware of what's going on and they know about the programs.
Thanks so much.
Thank you.
Any other questions for Rosalind or Carmen?
Just
Yes,
one
Michelle.
quick, yeah, one quick one. Hi, Rosalind.
Good morning.
I'm just curious if you're utilizing telehealth in
Yes.
conjunction with your MAR. I know you have the clinic once a week, which is fantastic. Just curious if telehealth can extend maybe those days or hours or services and also accommodate remote needs.
Yeah, we have been using telehealth with the providers. Some clients are coming on the designated MAT days, but then if people are not able to come those days, we can add them to another date for a visit. So we are using telehealth to have different times and dates so people can get the services that they need. It's really been helping with the behavioral health component because sometimes when the clients come for the telehealth visit with the medical provider, they might not want to stay for the whole visit with the behavioral health person. So we can schedule them for a different date at time to make sure we're giving them the treatment services that they need and support.
Thank you, Michelle. Any other questions for Access? Okay, seeing none. I just want to echo what Karen said, Rosalind. We're thrilled to be partnering with you and Access Community Health on this site in West Chicago. We think it's going to do a lot of good. So we look forward to working with you now and in the future. And you know, we'll look forward to the next update at the next meeting.
All right, thank you. And also we're in the process of creating prom cards and flyers to be able to pass out to the different agencies within the area so we can make sure people are aware that we're there and the work that we're doing. But if you need anything, please contact myself or Carmen Burgos, and we'll be willing to help any way we can.
Great, thank you so much.
Thank you.
So the next update we're gonna have is from the DuPage Health Coalition. So I am going to turn that over to Kara Murphy right now for an update. Kara.
Great. Good morning, everybody. Can you hear me okay? Great.
You can.
Okay. So to remind you, the Hope Task Force was really generous in providing the DuPage Health Coalition $50,000 to support what we hoped would be a really dramatic expansion in the number of emergency room providers that were X-waiver certified and positioned to be able to induce medication-assisted treatment when patients were presenting in emergency room settings. Secondarily, our goal was really just to expand X-waiver certification more broadly, but the funding very specifically was to support getting, we continue to hope, about 75 ER physicians around the DuPage County area to be certified, and additionally to offer 4 what was at the time thought to be in-person trainings that would support that X-waiver certification locally. As you can imagine, any project that was focused on A, emergency room providers, and B, in-person trainings encountered a few challenges in the spring, but I really actually have very, very good news to report. So we have capacity to serve at least 75 providers. We did delay our launching of our own trainings because that ER surge was really such that it was taking all of the emergency room physicians' time and energy, and they needed to be able to focus their energy on COVID. But now, as we begin to see a return to something that is closer to what feels like normalcy, and yet, as most of those folks are not in a position to travel or perhaps take time off for other reasons, it's actually a pretty good time to be offering trainings. Now we have moved to a remote training model, so we're using Zoom like everyone else. We actually have our first PCSS X-waiver training happening in 2 weeks. And we have 13 people signed up for that training right now. We have also already provided reimbursement for 15 providers around the county to complete X-waiver certification using other mechanisms. And in fact, we've had far more providers that have X-waiver certified in this period since January till today than even those that we've reimbursed, because some of the health systems have taken the tactic of supporting and funding those providers' completion of the trainings on their own, and therefore have not submitted for reimbursement through us. One of the nice things about moving to a virtual training is that we don't have the same volume limitations that we might have had otherwise. So we're actually opening up this training and the other trainings that we'll be offering over the course of this summer and fall to larger numbers of people than we would have been able to support in an in-person session. Dr. Holtzford and Dr. Tom Eisman, both of Northwestern Medicine, are going to be doing this training in July and are positioned and excited to do additional trainings throughout the end of summer and fall. They have no limits on the number of folks they're willing to have participate in their trainings. We've set a limit of 200 people, and I don't expect that we're going to see those numbers. But we've also, it means that we don't have to limit it to emergency room physicians only. So we're only able to reimburse emergency room providers for their X-waiver certification, but we're able to allow anyone who's interested in participating in this training to do so, because there's no incremental additional cost. And so we're really actually quite encouraged that we are going to see providers expanding MAT certification, not just in emergency room settings, but in primary care settings and other locations as well, which were sort of downstream goals that we were looking to achieve. At the end of the day, I think it's very likely that we will actually hit our numbers, both in terms of the number of people that end up X-waiver certified and the number of trainings that we're able to offer. So even though we had a little bit of a bump in our accrual and in our trainings for the period, especially in March, April, May, we are back on track. We've had huge increases in Northwestern medicine physicians that are X-waiver certified, huge increases, which I think Dr. Weiner and others should take credit for over at Edward Elmhurst. And we know that Good Sam is planning on sending a lot of providers to these trainings that we're offering. So I think we're going to see some good numbers there as well. Every reason to believe that's also true at AMITA. I'm just sort of reporting the anecdotal information about what I've got. But I think that probably the combination of the availability of these resources, a spotlight that Dr. Jorgensen and others are shining on this issue, and the fact that these ED docs are seeing very acutely in their hospitals the consequences of folks going without treatment. I also really want to say that it's exciting as we prepare a whole new group of emergency room physicians to be able to prescribe medication-assisted treatment. They also are buoyed in that effort when they can refer to Access Community Health Network, the health department, VNA, and all of these other community providers. No ED doc is going to want to induce for medication-assisted treatment if there isn't an adequate place to refer someone to for the next stage of care. So all of these pieces are really kind of a puzzle that come together, and it feels like it actually is coming together the way it's supposed to.
Thank you so much, Kara. Any questions? I think, yes, Judge. Please
So
proceed.
I actually don't have a question, but I was hoping to possibly hop on next just for a quick update from the court's perspective on behalf of Chief Judge Guerin and myself. If you guys don't mind, I have a courtroom full of some defendants waiting that I need to see. So if that's okay with the group, I would just like to give a quick update.
Yeah, of course. Please proceed. And Kara, thank you so much. We'll obviously entertain any questions for
Absolutely.
project shortly, but we appreciate the update and look forward to partnering further with you too. Judge, please proceed.
All right, great, thanks. So first I want to start by just really thanking the work that the Hope Task Force is doing on a daily basis. It's just been tremendous. Thank you all for your efforts in battling this epidemic. So I play a small part, I guess, on the front lines of this battle. I preside over DuPage County's focus call, which some of you may know is the felony court call that primarily centers upon first-time opioid offenders. And then also the drug court, which is a portion of my court call where it is really a therapeutic-based alternative to incarceration. So in my position, I get to see the full spectrum of opioid usage and addiction. Excuse me, anywhere from the focus group, which is our low risk, low need population, all the way to the high risk, high need. And so 2 years ago when Judge Guerin implemented the focus courtroom, it was really to shine a much needed spotlight on the growing epidemic within the 18th Judicial Circuit. And so he structured this court call in a way that allows me and my entire staff to have specific oversight on an opioid user very early on to get the person clinically assessed, evaluated, and then hopefully compliant. In drug court, I have the ability to have ultimate supervision on each participant. on average, I was seeing each individual in my courtroom every other week. So now all of a sudden, you know, the pandemic hits, and luckily, I, along with Chief Judge Guerin, we tried to anticipate some of the challenges that would have been created by possible increased drug usage during the pandemic. So very quickly in mid-March, I developed a comprehensive pandemic plan for my courtroom to ensure that we are still monitoring those that are in the focus group as well as drug court participants, that we were in fact following guidelines that were set forth by the Illinois Supreme Court to make sure that treatment responses that were needed for people in my courtroom were still being issued. And so, you know, in looking at everything that's been happening in the last few months and the very valuable information that Dr. Jorgensen has put out, I absolutely think he's correct that we must continue to reach out and stay connected even during this time. And so just a quick update on what my courtroom and what our circuit has been doing since mid-March in response to the pandemic and obviously the growing opioid use. First of all, for my particular courtroom, I have been conducting remote staffings. And what that means is that I have a staff for each portion of my courtroom. For the focus courtroom, we were staffing every Tuesday, even when the courtrooms were shut down. And then for drug court every Wednesday. And during these Zoom calls, my staff, which includes the state's attorney's office, public defender's office, probation, and the health department, we are determining what needs to be done next for each individual in my courtroom. So that's whether a sanction is needed, someone has relapsed and we need to get the person back into treatment, whether the person's doing extremely well. And, you know, it's important to recognize that the ones that were doing well during this time, and then come up with a plan for next steps. So we started with the team meet every week, and then we would determine who those group of individuals were. And then we started conducting staffings with particular defendants in the courtroom. And it would be, the defendant would jump onto the Zoom call. And I think it was extremely important that they knew that not only that we had eyes on them, but that we cared about what they were going through during this pandemic. And so, you know, I'm happy to report we didn't have, while we had slip ups and relapses, we were able to connect every single individual to a next step. Additionally, the staff was undergoing training during this time. National organizations like the National Association of Drug Court Professionals, SAMHSA, which is our big Substance Abuse and Mental Health Services Administration, and then also our own kind of local backyard with the Illinois Supreme Courts, they were putting on weekly and monthly webinars, and my entire staff would get onto those to make sure that we were really modifying and adapting court procedures during COVID-19. I'm also have been appointed to the Illinois Problem Solving Court Association, which is part of the Illinois Supreme Court. And so I had the privilege of working with other judges throughout the state to make sure that we were similarly attacking this problem during our courtroom shutdowns. And then of course, obviously I couldn't do anything that I was doing without the partnerships that we've established. And it's the same partnerships and partners that make up this task force. So the DuPage County Probation Department and health departments, they are my biggest resources in what I'm able to do on the bench. They were giving me constant guidance. We have specifically assigned probation officers for my courtroom. And that's important because they have a direct line to each defendant that's in court. And so they're my first line of attack, and I'll know very quickly if on a Friday afternoon, even though my courtroom is shut down, that someone has relapsed. And we'll get together as a team and come up with a plan. As far as drug testing was concerned, during the height of the pandemic, obviously there wasn't a face-to-face ability to drug test. but the probation department was fantastic in sending instant tests, mailing them out to specific individuals. Probation officer would get onto a Zoom call with the defendant, watch them take the instant test, and then results would be obtained within 10 minutes or so. And if it was a positive, that probation officer is right there with the person, giving them an opportunity to, one, be honest with usage, and two, a viable next step of what to do, whether it was a brief check-in at a hospital, a call with a treatment provider and such. And so now obviously that has broadened, that we are back up and running, at least my courtroom is fully up and running. Probation's able to drug test, and I am sending anyone that is a high risk opioid user for drug testing. And again, information is, that knowledge is power for us. So we're able to, with that information, make sure to the best of our ability that the person is not at a very high risk for overdose. And that's, one of the premises where we start from. Where is this person really on the spectrum of a potential overdose? And working with probation and the health department, we have a lot of different metrics that we use to make sure that we get someone that assistance. We have great relationships with treatment providers throughout DuPage County. And during even the height of the pandemic, we were able to place several people that are in my courtroom into a treatment facility, which was a little bit unheard of, but we just made phone calls and reached out and were able to make those connections and get people the help that they needed. I have a staff clinician who communicates with treatment providers. She works with insurance companies to make sure that several policies can be utilized in order to get people help. And then she also connects with family members when appropriate. So we try to do an all hands on deck approach, especially during this time. We are already dealing with a very vulnerable group of people. And then you add to this a pandemic that has, as Karen has mentioned, this nebulous cloud. We don't really know where this is headed and how it may grow or dissipate throughout society. And so, we're dealing with a group of individuals that they thrive on structure in some ways. And when all of that structure was taken away, they couldn't work, they couldn't go to school, they weren't coming to court. It was very alarming for them. And so my goal during this entire time, prior to coming back full force, was to make sure to have constant contact with practically everyone that I see in my courtroom. I know that with the jails, with our jail, the recovery pods are up and running again, and we utilize those to the best that we can, and definitely send many of my defendants to utilize the medically assisted treatment services that they offer, which is a fantastic bridge and gap when someone is using, especially opioid, and is at a risk for overdose. And then of course the health department during this time, made Narcan available, readily available to our community, offering curbside pickup, mailing Narcan to people that needed it, and then offering training on how to use it. So I'm sorry, I feel like I'm talking a mile a minute, but I just wanted to give a quick update that we know this is happening. We have been prepared for it, at least within the circuit, in trying to do the best that we can by the people that we serve. Karen is absolutely right that the in-person ability that I have now with court being back fully in session has been really invaluable. I'm helping to get a lot of people back on track that were really suffering during this time. So I'm just going to end with a few further thoughts, which is we know that even with the best laid plans, this population is at risk. And I know that for focus and drug court, the 2 dockets that I oversee, Judge Guerin has encouraged a very comprehensive case management model that is both sensitive to the current health crisis that we're facing and then the ongoing battle against opioid addiction. So feel free to reach out to me at any time. I'm happy to answer questions regarding what we're doing with programming in my courtroom. Also, feel free to reach out to Judge Guerin if you have any questions. I can take a few questions now if anyone has any. Otherwise, I will jump on the bench.
Great. Any questions for the judge? Well, Judge, thank you so much for that update. We really appreciate everything you and doing at the 18th Judicial Circuit. And, I think some of the successes that you've mentioned are frankly a reason why the Focus Court has won a National Achievement Award from the National Association of Counties. So thank you so much for being an invaluable partner to the Hope Task Force, and we look forward to working with you. And to the rest of the task force members, if any questions pop up for the judge after we hop off the line, feel free to reach out to her directly. But thank you. I know you have a courtroom
Thank you.
wait.
Yeah,
So
thank you,
thanks for
everyone.
joining.
Take care. Bye.
Thank you so much. All right, so I know we're coming up on the end of time here. I hope for those that have to drop off, I completely understand. Lane and I completely understand, but I think if it's good for the rest of the group, we're going to plow forward with the agenda and hopefully wrap up a couple minutes late. But there is some updates that we did wanted to give that are pretty time pressing. So one of those, I will ask if anyone has any questions. Let's save them to the very end when we do a roundtable. But I'm going to turn it over to Mila to give an update on the DuPage Narcan program. Somewhat brief and truncated update, Mila. I know I'm not giving much time, but there's some great work been done in the last couple months, especially in the time of COVID. So I'll let you talk through that.
Thank you, Greg. Good morning, everybody. It's nice to see all of you. And the judge just kind of pointed to some of the things that we've been doing with the Narcan program since the COVID-related changes to services. But I'll start by telling you that in 2020, we have seen an increase in uses. So we've had about 145 uses of Narcan this year so far. But in the first 6 months of those uses, 102 of them have been successful reversals. So that is good news. I think that the remaining uses there that weren't successful reversals point to what Dr. Jorgensen had mentioned, that there's just a lot of different drugs out there, and you know, the Narcan only works on the opioids. So we're doing everything we can to make sure our first responders have Narcan on hand, that their access to replace the Narcan that they're using is easy and contact-free. So we have gone with curbside Narcan, and for first responders, we have increased their supply frequently so that they don't have to come in very often to pick it up. One encouraging thing I think that shows in that 145 uses is that police and community members are not hesitating to use Narcan, even when something like COVID is out there, and that, you know, there's been some question if that would make them hesitate. And certainly we have not seen that. So we are maybe thinking that there was maybe some delay in reporting because people were very busy, and first responders in particular were very busy. But the first 3 months of the year, we had about 35 successful reversals. And then in the second 3 months there, from March, April, and May, we saw a big increase to 60. So we may trend a little higher than last year, but so far we look like we are about the same as last year, depending on how, you know, the summer goes for us. So we'll keep tracking that. We, in addition to tracking the Narcan reversals, we also stay in touch with the Illinois Department of Public Health and OD MAPS to make sure that we're seeing any increases in emergency room visits due to overdose, and certainly anything that OD MAPS is picking up as well. So we're watching those. Looking at the Narcan distribution, the state has provided us an increase in funding with a specific directive to purchase more Narcan and make it readily available to people at risk. So beginning in March, we did that and focused on the MAT and methadone clinics in DuPage that are seeing our most at-risk patients. So from March until the end of June, we were able to push out about 2,000 doses of Narcan. That includes 6 treatment providers in DuPage County and really covers the county pretty well That includes working with probation and working with the court system, working with our public defender's office, and several of our foundations that are actually represented here on the task force as well. So Brad and Path to Recovery, thank you very much for what you've been doing. The Lisle Woodridge Fire Department is also still working with us to make sure that their community members that experience an overdose can receive Narcan and keep that at home. And we have seen an increase in general community members utilizing the website to have Narcan curbside or delivered to them when they experience an overdose. Another positive aspect of the awareness and outreach that's happened with our hospitals that we've been talking to them about, making sure that awareness of our programs is available to the patients that come through their doors as well. So that's what we've done with distribution. We have done a lot of adjustments to training though, and that is probably the thing that I think makes the Narcan accessibility easiest for people that need to learn how to use it. So if you go to the Hope DuPage training page, you will see 3 training videos. 2 of them are in English and 1 is in Spanish. The advantage there is that the 2 English ones are provided by seasoned Narcan trainers, and also both of those individuals have a background with the courts and have a background with our mental health programs in DuPage County. So we're happy that those training sessions that are about 15 minutes each can be viewed on the website at any time. They also are mobile friendly on your phone if you're looking at them from the website on a mobile device. So we're very happy about that. That virtual training is a big piece of what we're focused on. And then lastly, to kind of keep us on time here, I know we're a minute or 2 over, is we wanted to build awareness of the helpline, the Illinois Free Helpline, which is 1-833-2-FIND-HELP. We've been pushing digital ads for the helpline because they have been actively connecting people to treatment, letting them know about the Narcan services. And if you compare June's numbers of calls from 2020 to last year of 2019, we've actually seen an 80% increase in calls to the helpline in DuPage County, which is really outstanding. So if any of your programs need cards or need more information on the helpline, we're happy to furnish those for you and provide you any, card holders or any resources you may need to make that number very visible to your clients. That is my update. If anyone has any questions, I'm happy to take them or to respond to you later after the meeting. Thank you.
Thank you so much, Mila. Appreciate it, and great work with that program. I know it's gotten some attention in the news media as of late, and it's all important to get the word out. So thank you for the update. Lanny, I'm going to turn it back over to you to begin the roundtable. I know we're going to go to Cheryl Marquet first because she has a conflict. She's been generous with her time to stay on, but Lanny, I'll kick it over to you to run the rest of the meeting here.
We sure will. Thanks, Greg. So let's go right to Cheryl with your legislative report. Thank you so much, Cheryl, for being with us today.
Oh, sure, Dr. Wilson, thank you. And I will be brief. Member Hart had asked that I provide a brief update on any state or federal legislation that may be of interest to the task force. And clearly the theme this morning has been telehealth, and that is also a theme before Congress. And I guess removing some of the barriers that apparently are there regarding insurance coverage of telehealth. So we'll start with the state. So as you know, Springfield had a very abbreviated legislative session this year. They recessed in early March before the primary, and then they came back for 3 days in May to conclude, its spring legislative session. Very few substantive bills were considered as a result. So the majority of key policy issues will be punted till either the fall veto session, which is in November and the first week of December, or in January when the 102nd General Assembly will take office. The one bill that I did want to highlight for the task force was Representative Conroy's legislation. It's Senate Bill 671, and it was actually House Amendments 2 and 3. And it was a telehealth bill, and the specific name of the act was a Telehealth During the COVID-19 Pandemic Act. And the purpose of the bill, which unfortunately did not pass the Senate, it did pass the House, but they ran out of time due to the short session. But the purpose of the bill was to provide for expedited treatment of health conditions during COVID and specifically to require that all health insurers regulated by the state to cover the costs of telehealth services rendered by in-network providers, including psychiatry, mental health treatment, substance use disorder, and related services through electronic or video technology, video conferencing. We did speak with Representative Conroy yesterday, and she is still negotiating with the insurance companies who were in strong opposition to her bill. And she's hoping to move it forward either in veto session or next year, but she is going to pursue the telehealth insurance mandate. The second issue that I think will be a topic of another meeting since we're out of time, Representative Conroy did obtain in the Rebuild Illinois Capital Bill this session a $5 million capital project for DuPage County to construct a central receiving center. And this is a concept that's still very early in the stages, which Director Ayala can speak to, but it would be something that I think this group has talked about, which would be a place where you could have individuals obtain immediate care for mental health or substance or opioid use disorders. And it would be constructed on the site of the county's old youth home across the street. So I believe the total cost, Karen, is 10 million, but we're also securing some grants and looking at the county putting in some funds, but that will be a really exciting opportunity. So we're very grateful to Representative Conroy for including that 5 million in the capital bill that was passed this session. I'm going to skip over a few other things since we're out of time and just go quickly to a federal update. I have lists of federal bills if anyone is interested. There's probably 50 to 75 pending right now in Congress. A lot are telehealth, a lot on other subjects, whether it's increasing access to broadband in rural areas so they can even do telehealth, prescription drug disposal programs. It's a breadth of issues, but nothing's really moving right now. None of those bills are moving. Congressman Krishnamurthy's office, he says hello. Actually talked to his staff yesterday. And there are 2 bills that are moving actually that passed out of the House Energy and Commerce Committee that may be of interest to you. They passed on Wednesday. The first is HR 5201. And this would be a huge change. It would permanently include a patient's home as an eligible originating site for mental health services delivered via telehealth and remove Medicare's current geographic restriction on receiving care. This would be a big step forward to have Medicare reimbursed mental health services via telehealth in someone's home, especially in rural and urban areas. This bill is strongly supported by the American Psychiatric Association because they believe it would help people suffering from substance use disorder to gain access to treatment. The second bill, as you know, is HR 7539. And as you know, under current law, health insurance plans must cover mental health and substance abuse services at the same level they cover medical and surgical services, the parity bills that have been passed previously. However, there has been a lot of cases where this is not occurring. So this federal legislation would require the Department of Labor to conduct random audits of insurance plans to make sure they are abiding by existing parity laws and to make it public knowledge when these plans are not in compliance. And with regard to appropriations, Congress's, the federal government's fiscal year begins October 1. They're currently negotiating the fiscal year 2021 budget. The bill that's under the Labor, Health and Human Services, education related agencies, which includes substance abuse. There's $3.8 billion for substance use treatment in the fiscal year 2021 budget, including opioid treatment and recovery, as well as $209 million for substance use prevention. And the Congressman's office couldn't give me the exact number, but that it is above this year's level. And then you're probably all familiar with the HEROES Act, that is the forced stimulus that is pending in Congress. They are returning next week. And the HEROES Act, which is the House version of the forced stimulus, which the Senate has declined to take up, but they are coming up with their own bill. But the HEROES Act did include $3 billion for substance abuse and mental health services administration, including 1.5 billion for substance abuse prevention and treatment block grant. And as Karen could note at a next meeting when we have more time, as you know, DuPage County did receive $161 million in CARES Act funds. Close to 17 million of that was allocated to the health department, including, I believe, 350,000 for telehealth and a lot of other education programs that will certainly touch on recovery and treatment. So that is also a big part of what the county board has been doing, is allocating those CARES Act funds. So I'm happy to forward some of these documents that I referenced to Penny to distribute, but I know we're out of time, so I'm happy to take any questions. Thank you.
Thank you so much, Cheryl. You're a wealth of information. My goodness, I could listen to you all morning long. Thank you so much. So we'll look forward to seeing that information through Penny. Greg mentioned earlier that we have a national award winner through our Focus Corp, but there's another national award winner that you'd like to tell us about, right, Greg?
Yeah, there's been a couple things that have happened since we last met, but I want to recognize Lisa Shavak, who is obviously one of our task force members who oversees WorkNet DuPage. A lot of you may have remembered the Ramp Up program that was launched last year. In just the 1 year of existence, 2 cohorts, Ramp Up has managed to win a National Achievement Award from the National Association of Counties. That's in addition to a State Innovation Award that was won earlier this year. So within a 1.5 year time frame, I'm proud to say that this task force has won 2 National Achievement Awards. And Lisa, we just wanted to recognize you. Thank you for all the great work. And more importantly, thank you for all the impact you're having among those who need the most in our county. So thank you.
Thank you very much, Greg.
Good job. Thank you, Greg. Usually our meetings in the past have been 2 hours, but we tried to condense it to 1.5 hours. That was wishful thinking. This is too powerful a group to handle it all within 1.5 hours. For those of you who have to leave, we totally understand. We're already almost 15 minutes past our time. However, in honor of those who have come and have something to say, I'm going to ask your permission to end the meeting at 10:30 rather than at 10 as we had hoped to, in order to give people a little extra time. Again, if anyone has to leave, I think hopefully you've been blessed by the presentations that we've heard this morning. You can see that there's a lot of work that's been done and a lot of work that needs to be done. Dr. Jorgensen shared with us the importance of the work that we're doing, and we can't let up. We can't let up. So having said that, I'm just going to open up the floor to see if there's anyone who has any burning reports they'd like to share with us. And if not, then I might tap a couple of people on the shoulders to tell us what they're doing. So the floor is open. Who'd like to speak next?
Hi, it's Jim Scarpe. Sorry, I had to switch to my phone from the camera because I was heading out to a meeting. But I did want to let everyone know that we are moving towards opening the Downers Grove facility as we discussed at the last task force meeting. It'll be on 3040 Finley Road, and we're hoping to open in October. It will be an outpatient program. We'll be able to serve Medicaid, unfunded, as well as Medicaid managed care and insurance clients there. And we'll start with some evening groups, 5:30 to 8:30, so that people can get there after school or after work. And everything's on track. We're doing the build out and hoping to have an open house, whether it be virtually or face-to-face sometime in late October or early November at the latest.
That is exciting news, Jim. We've been waiting for this to happen, and great news. Our next meeting will be October the 16th, so maybe you can give us a progress report and maybe tell us when your open house is going to be.
Absolutely.
Thank you, Jim. Anyone else like to give a report?
Lanny, real quick. So I did make mention that we have a couple DuPage County board members that have joined the line. One of them is member Dawn Desart. I believe she's participating via the YouTube live function, and she sent over a question to me that I want to ask on her behalf. Brad spoke eloquently about reaching out by phone to those who may be struggling with substance abuse disorder and isolation during the time of COVID. I believe the question probably should be directed to Chris Hoff. Chris, so does the county or other agency keep a list of those who need support, and how can they be assisted moving forward?
Sure. Yeah, thanks.
those that may be struggling and have reached out via phone, the hotline.
Yeah, thanks, Don. So yes, our behavioral health group and crisis services has remained operational 24 hours a day throughout the COVID pandemic, and has been keeping in touch with our clients. Those are generally people that are engaged in services with us or are calling us with a crisis mental health need. They do that around the clock all the time, and they've continued to do that through the pandemic. And we are happy to take those calls. So we can certainly share out and continue to promote our crisis behavioral health line, so that anybody that does need that sort of support, wants that type of check-in, can get it. And I'll post the number in the chat here, and then we'll make sure that that's continually promoted in our social media and website, because that is a great service.
Great answer, Chris.
Thank you, Chris, and thank you, Don, for the question.
Greg, just to add, the Illinois Helpline is taking referrals from the Call for Calm line, and they've done some linking there and offers a lot of follow-up as well and linkage to service. So there is, that's for everyone, not just DuPage County residents, but there's some linking there too.
Great, thank you. And Dawn just did want to say thank you to the health department and Karen in particular for the excellent COVID update. Hopefully we might be able to maybe bring that to a county board meeting in the future. So thank you for that again.
Thanks, Greg. I know board member Liz Chaplin is also on the line. So thanks for all the board members who have taken the time this morning to be there. Any other updates? Mr. Bernard Murray, I don't know Bernard Murray too well. Tell us what you're doing this morning. You need to unmute, Mr. Murray. Thank you. Still can't hear you for some reason. Still can't hear you. I can see you and see that you're trying to communicate.
Maybe having some technical difficulties.
Yeah, some technical difficulties. I'm sorry. I was looking forward to hearing from you, Mr. Murray. Yeah, darn it. The problems with this online meeting, they're not perfect communication tools by any means. Any other remarks this morning? Darn it. I see Kara Murphy's face there in front of me, and listening to her report and Access's report and the report from the focus court. We've certainly spent our money well that the DuPage County Board has given us the ability to use. So I look forward to what we'll do in the future with those kinds of monies, but it certainly is very reassuring to see the work that you all are doing with those little dollars that we give you. So I'm going to probably ask that in the future that we'll have a 2-hour meeting instead of the hour and a half, just so that people can feel relaxed, not feel like they have to kind of squish their report into a small amount of time. And that way we like to start on time, we like to end on time, and we're certainly have taken 20 minutes extra of your time today. Any last minute reports there? Brad, thank you so much for being with us. Your report was phenomenal. As you can see from board member Desart, you inspired an important question.
Thank you.
Yeah, good job. Tim, I'm seeing your face there. Anything happening in your world? Anything you'd like to report on?
Thank you. I think the judge did kind of give an encapsulation of what we're doing in focus and in drug court, but we've had the double, like everybody else. We've had the issues of the courthouse more or less being closed down, and our ability to reach people and interact with people greatly curtailed. Once we did start coming back, when the courthouse started to reopen, we immediately started drug testing with our high risk, high need opiate users, and we're getting them in here right away. We've since expanded that to include all of our wellness courts, which we liberally expand to include our task caseload, which is primarily made up of higher risk opiate users as well. the focus court, drug court, our mental health court, which oftentimes gets overlooked in these situations because a lot of our clients in our mental health court also do have very significant opiate issues and very significant co-occurring issues with substance abuse. And then our new veterans court. So we've expanded that testing to include all of our current courts. You know, we did maintain connection with people as best we could during this really odd time. I didn't break it down by wellness courts, but our division did log almost 10,000 contacts during COVID. A lot of it was phone calls, a lot of it was virtual calls. We used Microsoft Teams a lot. We used Zoom some. We used video conferencing in different formats to keep engaged with people. And now as we're starting to reopen, you know, we're seeing more and more people in the office, and that's presenting certain challenges as well. But, you know, we are committed to increasing our ability to get out into the field and to see people more. So, you know, we hope to see some ongoing and continued success in that.
Tim McGavin, thank you so much for that report. Give our greetings to Bernadine, if you would.
Thank you.
Looking around, Jeff York, can you unmute and just say hello for a couple of minutes? Jeff York, are you still there? Andrew Anselm is not shy at all. Andrew, can you unmute and say hello?
Good morning. Yes,
hey, Andrew.
Andrew Anselm
Yeah.
with DUMAG. With the increase in overdoses, we've been very busy, even with COVID. We were restricted in a lot of things, but we worked a lot of drug-induced homicide investigations. I'm hoping that in the next few months, a couple people at least will get charged for drug-induced homicide for selling to victims that died. And then also, on another positive note, we're working with the Department of Human Services, and I don't know if it's going to be in the next couple of months or not till next year, but at some point it's looking like we are going to have a social worker assigned to respond to any needs we need at DUMAG. It probably won't be in the office. It'll be more of an on-call type of thing where if we are dealing with users, or we can call them and get them help.
I love that idea of teaming social workers with law enforcement, my friend. That's good to hear.
It's in the beginning stages. It's going to happen. It looks like it's just a matter of when.
Sure. Good news. Anyone else have a report? I see we're Andrew. Are you still there? Yeah.
I am, yes.
Thank you. Anything else that you wanted to add?
Oh, no, that's it.
Okay, thanks so much. Andrew Anselm, Director, DuPage Metropolitan Enforcement Group. Okay, I think we've come to time to end. It's been a great meeting. Oh my gosh, I could have spent all morning listening to Dr. Jorgensen and Brad Gerke and those reports. We needed to spend time talking about the pandemic as well, friends. I know it's not directly what we do, but indirectly, as you can see, it affects everything we do, including this important work that the Hope Task Force is doing. Our next meeting is scheduled for Friday, October the 16th. I'm going to be lobbying for 8:30 to 10:30, so unless I get outvoted, that's the time frame we'll be looking at. Greg Hart, is there anything that I've left out?
No, I think we covered everything. Just to ask to the task force members if there are any topics that you would like covered or think would be good topics of conversation at the next meeting, feel free to email Lanny, myself, Neil, and Chris. I will make sure those get added. I also will make reference, if I hadn't before, that at the next meeting, we'll be having an update from the Edward Foundation, which is our other grant recipient for the Hope Task Force. So we look forward to hearing from them. But thank you all for joining so much. Really great discussion.
Likewise. We'll sign out. Take care. Be safe.
Thanks, everyone. Take care.
Bye-bye.
Stay safe.
Okay, thank you.